To err is human, and yet, healthcare providers can still be blindsided when they're hit with a malpractice claim or have an unexpected outcome after a case. It's the last thing you want to deal with, and it can certainly be a blow, emotionally, physically, and sometimes financially. But how often are doctors really sued? Is there a certain specialty or gender that's sued more often? Does age or practice location have any effect on the likelihood of being named in a malpractice claim? In today's episode, we're going to answer these questions and help unpack this topic in a bit more detail so that you can have a better understanding of your personal exposure and then take the appropriate steps to educate and protect yourself. Welcome to Malpractice Insights, the show dedicated to helping healthcare professionals understand medical malpractice insurance and providing you with the solutions you need so that you can get back to the work of practicing good medicine. My name is Jennifer Wiggins, CEO of Aegis Malpractice Solutions, and I'm so glad you've joined us today. If you're new to our channel, welcome. Thanks so much for being here. We release a new episode every week, both on YouTube and your favorite podcast streaming platform, so be sure to like and subscribe to stay connected. All right, let's jump in. Experts have been compiling data on physician malpractice claims for years, and unfortunately, the results show that getting sued is not an uncommon event for doctors. In a recent poll conducted by the American Medical Association, 34% of physicians surveyed said that they had been sued for malpractice, and nearly 17% have been sued 2 or more times. By the time a physician reaches retirement age, there is a 51% chance that he or she will have been named in at least one malpractice claim during their career. And those practicing in surgical specialties will see that number go even higher, with 80% of surgeons being sued at least once in their career. Malpractice insurance carriers keep a very close eye on claim data, and they're constantly analyzing the information to inform their clients and improve outcomes, but also to ensure that they have enough money in the bank to pay for future claims. General claim trends show that change has been fairly stagnant over the past decade in the malpractice world. But despite lower claim frequency, average indemnity payments and expenses are starting to trend upward. In 2010, the average indemnity payment for a malpractice claim in the United States was around $340,000. In 2019, that number has crept up to $410,000. Doctors are still winning the majority of malpractice claims, with the industry hovering around 80% of all malpractice cases being closed without payment. But when carriers have to pay, they're paying a little more than before. So why do patients sue? There are a variety of reasons why a doctor might be sued for malpractice. Medscape recently published their own survey of malpractice data, and their findings were consistent with the rest of the market. The number one reason why doctors are sued for malpractice is because of a failure to diagnose or a delayed diagnosis. These types of claims account for nearly 31% of all cases. Following closely behind, complications from treatment and/or surgery result in 29% of all cases. Poor outcomes and disease progression result in 26% of cases. Failure to treat and/or delayed treatment are 16% of all cases, and wrongful death cases are at 13%. Outside of these major categories, poor documentation, errors in medication, and issues involving informed consent are also reasons why a doctor might be sued for malpractice. So we've talked about the big picture when it comes to how often a doctor is sued for malpractice, but as you might suspect, there are some variables that can impact how likely it is that a provider will get wrapped up in a claim. Surgeons, both general and specialized, are the specialists most likely to be sued. Among those surveyed at Medscape, general surgeons and plastic surgeons topped the list with 83% reporting having been sued at least one time in their careers. They are followed closely behind by orthopedics at 81%, urology at 80%, OBGYN 79%, other specialized surgeons at 74%, emergency medicine at 70%, ENT is at 68%, radiology is at 64%, and cardiology is at 58%. Beyond specialty, practice location also has an impact on the likelihood of a doctor being sued for malpractice. The prevalence of lawsuits in any given state depends on a variety of factors, including the extent of tort reform, the culture, so how litigious is that area, the number of physicians practicing in the state, the patient demographics, and legislators' efforts to reduce frivolous claims. This year, Medscape reported the top 10 states for lawsuits as follows: Indiana, New York, Pennsylvania, Illinois, New Jersey, South Carolina, Louisiana, Tennessee, North Carolina, and Maryland. When it comes to the age of a healthcare provider, it does have an impact on the rate of claims. A recent study by one of the nation's largest malpractice carriers showed a chart of the rate of claims by age per 100 physicians. The data shows that claim rates for physicians aged 25 to 34 was 2.0. The rate for providers aged 35 to 44 was 3.6. The rate for providers aged 45 to 54 was 3.3. Age 55 to 64 was 3.2, and age 65 and up was 2.3. Surgeons who were between the ages of 35 to 44 had the highest claim rate overall, with 12.2 claims per 100 physicians. And finally, does gender have anything to do with the likelihood of being sued for malpractice? The evidence suggests yes. Male doctors are more than twice as likely to be sued for medical malpractice than female doctors, according to a study published by the journal BMC Medicine. Interestingly enough, this research shows that the disparity has not changed over the last 15 years, despite a growing presence of women in the medical field. The data continues to demonstrate that men are more likely to be sued for malpractice than women. Okay, so this is a lot of data. What does all of this really mean for you? Here are 3 takeaways to leave you with today. First, just be aware that malpractice claims are relatively common, and although you can make some choices to help reduce the likelihood of being sued, such as choosing your specialty or where you want to practice, much is unavoidable. So if you do end up being named in a claim, don't worry, you're not alone. Second, although it's not possible to completely avoid malpractice lawsuits, there are steps that you can take to educate yourself and your staff and to help prevent claims and manage risk. Contact your insurance agent to find out what risk management resources you have access to through your carrier. Most companies have a very robust risk management program, and they can provide you with training, practice consulting, and overall risk reduction techniques and strategies. Third, because of the likelihood of being named in at least one claim sometime in your career, it's important that you have a quality malpractice insurance policy in place that covers everything you're doing, both now and in the future. If you're not sure that you have the right coverage, or if you just need a fresh set of eyes to review the policy that you have in place to make sure that it still meets your needs, click the link in the description box below where you can connect with us via phone, email, or chat today. And if you're listening, please visit us online at aegismalpractice.com. That's AEGIS malpractice.com. We have some great episodes lined up for you in the next few weeks. Make sure that you're subscribed to our show so that you don't miss an episode. And if you found this information helpful today, could you do me a favor and give us a like and leave a review? Your feedback and support helps us to reach more people, and we're really grateful for your clicks and your kind words. That's it for this episode of Malpractice Insights, where we're dedicated to helping you understand medical malpractice insurance and providing you with the solutions you need so that you can get back to the work of practicing good medicine. This is Jennifer Wiggins. Thanks for joining us.